US. If you're watching me live on Facebook and YouTube, I must say you are very welcome. I want to take this opportunity to say thank you to all of you for always making a date with me. I'm always excited, as you know, because of course it's Friday and you are warmly welcome to Let's Talk About Health. The last time we met, which was just a week ago, we had the privilege of discussing a very important topic, depression. And what an amazing session we had that night. And I take this opportunity to say a big thank you to my resource person that night, Mr. Richard Emisa. Mr. Richard, if you're watching, I appreciate you so much because what a fantastic time we had. You obviously gave us an insight into depression, showed us how we should watch out for each other in terms of how low we get and how high we get, and how some of these things that we easily ignore in our daily lives can actually be very key signs of depression. Hopefully we learned a lot, and I did get a lot of feedback from all over. So thank you if you're watching me. You are warmly welcome to Omega Live TV, and we are live now on Facebook and on YouTube. As always, I'm very excited because, of course, I have another very important personality here tonight. And this person, we go way, way back because she happened to be my senior back in sixth form. Of course, it's Tadi, as you all know. So I will let her introduce herself, but I can't wait for this session. It promises to be a very good one. Of course, if you are a worker here in UK and of course abroad, it will probably be a good idea to tune in because what are we discussing tonight is occupational health essentials. A lot of us associate occupational health with disciplinary actions, but you'd find out by the end of tonight that it has nothing to do with disciplinary. And if there is anything at all, it will be in your best interest to have their services. So whilst reading about all the lots of information that was given to me, I actually found that unlike some of the other disciplines or professions where we look into diseases and we look into conditions and we seek treatment and at the end of the day try to find out and get some help from our professionals, their speciality is help, help, help. They always have help for workers, they have help for employees. So I can't wait for this one. So you are welcome again. I'll let my guest introduce herself like I always do. And I'll say, Madam Irene, you are welcome to the show. Please kindly tell us your name.
Thank you very much.
And yeah, what you've been doing up till now, please.
Okay. My name is Mrs. Aluminium. I've been in nursing for over 30 years.
Okay.
Over 10 years of that, I worked on the wards. I worked in intensive care units. I worked in A&E and then went into occupational health. And I've been in occupational health for just over 20 years as well.
Oh, that's a very long time.
Yes, so that's been my specialty.
Wonderful.
Yeah.
Right. So I always like to know where people did their training. Were you trained in Ghana? Were you trained here in the UK?
I trained in Ghana and then came here and did a first degree in general nursing, and then I did a postgraduate degree in occupational health and safety management, and then did occupational health nursing, also a postgraduate degree.
Wonderful. That's wonderful. So you've done a lot.
Yes.
So I hope you're watching me on Facebook and on YouTube, and I will be looking forward to joining me with the questioning.
Yes.
Because you are in very safe hands. So I hope you're ready. Get your phones ready. Go online. This is coming to you by kind courtesy of Omega Life Multimedia. And if you want to find Omega Life Multimedia, you can locate us on 74 West Green Road, N15 5NS. And you can also find us on 189 Wood Street, E17 3NU. And like I said last week, I had somebody who was sponsoring me for the first time, and it's Elegant Souls, S-O-L-E-S, Elegant Souls. And the person who is doing this for me is Mama J of Elegant Souls, and I appreciate you so much. So if you look down, you can find I am in the most amazing heels tonight. And this is all by kind sponsorship of Mama J of Elegant Souls. You can reach Mama J on 079630 Mama J of 0793693630 And I know Mama J is based somewhere here in London, so you can contact her and she will make you look amazing. So back to our topic now. Can you please tell us what is occupational health about?
Occupational health, in a very simplified definition, is a specialty in nursing that deals with the working population. So what we do is we look at the effects of health on work and work on health. By that I mean that if somebody has an underlying health condition and is going into work, we make sure that appropriate adjustments are made for the person to be able to work comfortably. And also, if somebody is working in an area where there may be hazards, work-related hazards, we make sure that controls are put in place to ensure that the person's work does not have an adverse effect on their health.
I see. So a lot of us, our first encounter ever with occupational health is at the point of having a job offer, isn't it?
Yes.
So why do we need to do all those things at the start of any employment?
Right. And if you say at the start of employment, in line with the government regulations, you should not be sent to occupational health unless you've been offered the job.
Right.
So when you are offered the job, usually they will say on condition that your references and occupational health clearance is fine.
Okay.
So when you are referred to occupational health, what we do is you are given a health questionnaire to complete. Mm-hmm. When you complete the health questionnaire, in the unlikely event or in the event that you have an underlying health condition, we ensure that the employer has put in appropriate support. So we make recommendations for the employer to put in support so that you are able to work comfortably. We do not disclose any of your health condition if you disclose it in the health questionnaire to your employer. So our service is extremely confidential. We would not disclose it to your employer nor your manager. It's everything you disclose in the health questionnaire remains confidential with us.
I see. So you will not even get to the stage of coming to meet an occupational health professional until you've been offered the job?
Definitely until you've been offered the job.
And what sort of assessments is included in this initial occupational health assessment?
So when you complete the health questionnaire and your HR or your manager will say, send it directly to us. Mm-hmm. You send it directly to us. We have a look. If there are no concerns, we will just clear you. Mm-hmm. There might be occasions where we would have to contact you over the phone to clarify. Assuming you declare something like stress, we would phone you and say, are you okay? Mm-hmm. Was the stress long term? What caused it? Is there any support that we can put in place for you before you start the job or as soon as you start the job? So, so those are some of the things that we will do. So there might be occasions, on rare occasions, where we would ask you to come and see us, and then we would see you face to face and send recommendations to the HR or your manager to put in place as soon as you start work.
Can anyone fail this initial assessment? Because they would have had a job offer already, isn't it?
Right. They would have had a job offer. Pending occupational health clearance and many a time references.
Okay.
It is very, 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 very rare. Majority of the time, we would recommend that the employer tries everything they can to put in adjustments for you to be able to work, to be able to do the job that they've offered you.
Yeah.
On very rare occasions, say if somebody has significant psychological problems and the person might be at risk to themselves and others, then we would say it might not be the appropriate time. Many a time we would say probably it will be in your interest to have treatment. And then once you've been treated, probably you could reapply. Or It could be something like if you're going to do a job where you're going to use your wrist a lot and you have wrist problems as it is. We would advise that the job could have a detrimental effect on your health.
Right.
There might be occasions where we would ask the employer to find another job for you within the organization if you are able to. So it's very, very, very rare to say, no, you can't have the job.
Very rare.
Yeah,
And
very rare.
Just to let our viewers know that we are not talking about health jobs only.
No.
Yeah. What are the area? What areas would an occupational health person be needed?
Almost every job, to be honest with you, from airlines, banks. I personally have worked for an investment bank.
Okay.
I've done very short contracts with an airline.
Okay.
So almost every worker would require occupational health. There might be some organizations that would not have occupational health facility on site,
Right.
but they might have one remotely. There might be occasions also whereby if it's a one-man sort of employer, say
Yeah.
if they have maybe 2 or 3 people, it might be unlikely that they would have occupational health because it could come up at a cost.
Yeah,
So
definitely.
yeah.
Yeah, I think a lot of people get worried to disclose health information
Yeah.
to, say, their managers, and sometimes even to probably you, the occupational health nurses. But how much assurance can they get? It's very important, because if it doesn't come up and
Yeah.
later something happens to them at work,
Yeah.
then they have a problem, isn't it? A
It's-
greater problem than they have. So what
Yes.
sort of assurance can we give them?
Right. The assurance I can give is occupational health. We are confidential, we are independent, and we are specialists. We are a team. We normally have a doctor. We could have psychologists. It can range from 2, 3, 4 members of the team to probably a 20 team of occupational health practitioners. When you declare your health condition to us, it is important that we keep it confidential. And it is important that you declare, because all that we would do is to ensure that you are supported. We do not disclose your health condition to the employer
Right.
or your manager.
Because I was going to ask that,
Yes.
because they hold you guys in confidence.
Yes.
So is it going to be declared to the employer?
No. We would only, with your consent, declare something, and that is in a situation where, say, if somebody is epileptic, we would say it is important that probably you let your employer, your manager, or a colleague know, so that in cases such as if there's fire and say you have a seizure,
Yeah.
somebody has to look out for you. So we would say that this person, say if we are writing a report to your manager, we will say this person has an underlying health condition where you might have to look out for them. We personally we wouldn't declare it. We would say if you are comfortable, then you can declare it, but we would not force you to declare it. No.
Right. And if later the employer finds out
Yeah.
about these conditions, will you be accountable for not disclosing?
No, because by law, you are not obliged to declare an underlying health condition. That's any condition that you've got. You
Okay.
only have to declare if you feel comfortable to do so. And that is why occupational health are there. So we would have the records. So if your employer or your manager says you did not declare that condition, you could say you declared it to occupational health, and they don't have to know. For instance, if I give an example, I know that a few weeks ago, a colleague of yours was gave a guest,
Yeah,
one of your
yeah.
guests talked about HIV.
Yeah.
If we go and, even though we should not shun people's company if they have HIV,
Yeah.
there is still stigma.
Yeah.
And sometimes we get people who declare HIV. All that we would say to the employer is this person has an underlying health condition where they have to take medication regularly.
Yeah.
So there might be times where they would need time off to go and see their specialist or their GP or to get their medication reviewed, we would not say to the employer what the condition is.
Right. So obviously now you've mentioned about HIV. I
yeah.
think it's a good point to chip that in.
Yeah.
Because I remember years ago, people would not be allowed into health, especially when they are going to be working in like theaters,
Yes.
or anywhere that there will be invasive
Yes.
procedures.
Okay.
Because there was the risk
Yes.
of
Yeah.
infecting their clients
Yes.
with it. Is this still the case now?
Right. I would say to an extent, yeah. But people with HIV, if they want to do certain jobs, can do it. We call it exposure-prone procedures. Exposure-prone procedures are procedures where the practitioner's finger, gloved hand, will be in an orifice. Say dentists, theater nurses, as you mentioned, midwives, surgeons. Right. If the viral load is undetectable.
Yeah, you see, so if you've been following this, you
Yes.
remember we did U equals U.
Exactly.
I love that so much.
If it's undetectable,
undetectable viral
then,
load.
yes,
right?
then you can basically carry on with what you are doing. But we need to keep an eye on you. You need to be taking your medication, and the occupational health physician would keep an eye on you. We'll call you from time to time in line with the government guidelines and check to make sure that it's still at the undetectable stage.
I see. So all that will be between you, the employee, and the occupational health.
Yes.
Your manager doesn't have to know about it.
No, your manager doesn't have to know. It's just between us, and our service is extremely confidential.
Right. So
Yeah.
it means these professionals can still do their duties like efficiently
Yes.
without any problem
Yes.
at all.
There might be situations where if their blood results are such that it's not safe, then we would advise. We would say to the manager, this person has a condition where, as I mentioned earlier on, they might have to find them another job. They will be redeployed into another area. So, yeah, so you would still probably have a job. That is if there's a job available within the organization that you can do. Yeah.
Yeah, right. So at the workplace, we do get a lot of referrals
Yes.
from management
Yeah.
to occupational health.
Yeah.
And I think for a lot of us, that is where the problem is, isn't it? Because we hardly get the chance to know what occupational health and their services entail.
Yeah.
So then any referral by the employee to, by the employer about their employee becomes a problem straight away. What goes in a referral anyway? What will be in that letter?
Right.
Yeah.
If, say, you've been off sick for some time, or you have a condition where your ability to work is being affected, or you've been off sick, say, for a period of time, and you are returning to work, in some organizations, they have a sickness absence policy where you have to be referred to occupational health. All that we do is to ensure that you are well supported to return to work. Sometimes we would advise your manager that in view of your sickness absence and what you've been off sick with, it is important that you are phased back to work slowly and not just shove you back into your full-time 9 to 5, 5 days a week, or night shift, or all sorts of shifts. There might be a situation where we would advise your manager that because of whatever you've been off sick with, maybe you should be exempt from night duty, or you should be exempted from certain things that you do, so that you recover fully and you are phased back gradually into work.
So a typical manager's referral to occupational health will not be damning then, isn't it?
No, it would not be damning at all. And also, in line with government legislations, you are supposed to see the referral. You are supposed to see what is in the referral, and you have to be given an opportunity to consent to it. Without your consent, you can't be referred to occupational health. And I've had situations where employees have come to see me and said, I did not know anything about the referral. I don't know what's in this referral. I have given them an opportunity to go back and discuss the referral with the manager. And I've said to the manager, this employee does not know what is in the referral, they did not consent to it, and therefore we cannot carry on the consultation.
Okay.
There might be cases where you could discuss the content of the referral with the employee, and the employee would say, that's fine, let's carry on. And at this stage, I would explain to them that the reason why your manager has sent you is because you need support at work. It's not disciplinary, or HR needs some information to make a specific decision. And many a time, it is important that employees agree to the referral, but if they are not comfortable, they cannot be forced to come to occupational health.
Right. So if they refuse to go to occupational health, what can they do then? Because obviously that will be their only way of, what do they do?
So
in that
say,
case?
for instance, if you've been complaining that you've got back problems and your manager has referred you to occupational health for us to make recommendations for them to put in support for you, and you refuse, that means your manager has not got the information that they require to support you, and therefore it will be at your disadvantage. Yeah.
Not to go.
Well, no, it would be a disadvantage if you don't allow the referral to carry on, because then your manager would not have the information that they need. Say, if you've got a wrist problem and you need a specific ergonomic keyboard, or you've got a back problem and you need a specific chair, and your manager has referred you, but you say, oh, I don't want to go, then your manager would not get the information that they need from us to be able to make a decision to support you appropriately.
Right. So the outcomes of the referral, it's expected to be in the interest of the employee, isn't it? So if they are not
Most of the
accepting-
time.
Most of the time.
Most of the time.
Right.
For instance, if somebody say is not performing well at work, it could be that they have an underlying health condition that is having an adverse effect on their ability to do that job. And therefore, again, we would advise that maybe they go and see their GP, or we would do a specialist referral. Say, again, I'll use back problem as an example, because that's one of the most common causes of sickness absence within the workplace. So we would say, go and see a physiotherapist, or go and see a specialist. So it's usually in your interests.
It's in your best interest.
Yes.
One of the few professionals who showed interest in coming onto this show was yourself.
Oh, yes.
Yeah, just so you know, because you are very, very keen on coming to tell us so much about what goes into occupational health. Yeah. So I think people may wonder, how does one become an occupational health specialist? And then all the activities that you do, because I'm sure it's broad, because a lot of us are thinking that, oh, it's only in the NHS you probably need an health specialist, or when you are unwell. So how does one go into occupational health?
Right, as I said, it's one of the specialties in nursing, just as a diabetic nurse, just as a health visitor. And it's unfortunate that so many people are not aware of what we do, and obviously that's why I wanted to raise a bit of awareness. So any qualified nurse can go into occupational health.
Right.
Occupational health nurses, just like a health visitor, we are registered on a part 3 of the NMC register, like school nurses, practice nurses, health visitors. It's a public health specialty.
Okay.
Yeah, but people don't realize. And the advantage of an occupational health practitioner is that we don't just work within NHS. As I mentioned earlier on, airlines have occupational health nurses, schools have occupational health nurses, though they might not be based in the school, they might be based somewhere else. Investment banks have occupational health, London Transport have occupational health, so many organizations have occupational health. So
Right.
there is a real advantage in doing occupational health nursing. Of course, I will say that because I'm a specialist in occupational health,
Yeah.
and it is a real good specialty. And
Specialty.
yeah,
You
and
never know, I may consider being one myself.
you are more than welcome, and I'm more
If
than
only
happy to support you.
my brain can absorb it.
It can absorb by all means,
Yeah,
yeah.
it's playing tricks these days, so I'm not sure whether it can take all the information. How long is the training for occupational health?
If you do it, obviously, you should be a qualified nurse, whether in mental health or general nursing. And if you do it full time, it's 1 year,
Okay.
and part time is 2 years.
So it's not
Yeah.
too bad.
No, it's not too
Yeah.
bad at all. And you know, even though they say 2 years, it's normally about 18 months, and then you qualify. Yeah.
Okay.
Yeah.
I do have a lot of viewers who watch from Ghana, from everywhere. As a
Yeah.
matter of fact, a lot of them are watching from Ghana.
Yeah.
Is it a specialty in Ghana?
I
Do you know?
not
You're not
very
certain?
sure, yeah. But as at the time I left Ghana, which is
A very long time
long
ago.
time, yeah, I know
Yeah.
that there wasn't. And I have tried to explore, and I doubt. I am not very sure.
You're not very sure.
Yeah, I'm not very
because
sure.
you know what I've been doing. You always watch my program,
I
so
do.
I know.
Yeah.
Yeah, and I've been asking people,
Yeah.
are you ready to go back and help in any way or form? Definitely there will be somewhere in the system you can fit in. When
I
you
will
are
be more than happy, yeah.
So what
to-
was the finding when you went to explore? Was it just not existent?
They were not very receptive because I think the awareness is not there, and it came across as if the HR person within
Human
organization,
resource
yeah,
people.
human resource people take on the role of occupational health. But I have a lot of concerns in that, and even here sometimes I find that because if somebody has an underlying health condition and a doctor writes a report,
Yeah.
sometimes even as a health professional, it's not as easy to unravel the issue. And with an HR person, they may not understand, and they may find it difficult to provide the support that the employee would require. So I think it is important that all organizations consider having an occupational health practitioner.
Yeah, definitely. I
on
think
board,
that would
yeah.
be absolutely necessary. Yeah,
Yes.
if it's not there in Ghana, because the thing is, you act under, it's almost like acting under oath, isn't it?
Yes,
Holding
definitely.
personal information.
Definitely, yeah.
Yeah, in confidence.
Yes.
Yeah, and we are not HR practitioners, so
No.
we don't have that speciality, so we don't know.
Yes.
It's just like anything in nursing.
Yeah.
You are working under like strict rules, and you are simply not allowed to disclose
No.
personal
No.
confidential information.
We don't.
Yeah, so
No.
if that specialty doesn't exist, then obviously we have a problem.
Yeah.
Because and that is why sometimes it's very easy to find all sorts of information about people all over the
Yes.
place.
Yeah.
Yeah, it's just because of the people handling it,
Yeah.
isn't it?
I mean, I'm not sure if they've started that now, but I'll be more than happy to support if required.
Yeah.
I'll be more than happy to
So
support.
get ready then, because we are all preparing to go back
I have
home.
to say that my manager might be watching, and she wouldn't be happy for me to
Now,
leave.
when we go on pension, of course, we are not going to be here forever. We are
Yeah.
not going anytime
Yeah.
soon.
Yeah.
You see, but the whole point of doing the show is trying to prepare us all for making Ghana better, you know,
Yes.
in any way that we can. So it's not even like us stopping our jobs here and going back home. It's even like when we go on holidays.
Yeah.
Because there is this group I always mention about, and that's something to do with the High Commission and trying to get, it's called Diasporan something. That
okay.
they are trying to get all the professionals together.
Yeah.
So when you go, even if you are on holiday for a month and there is an event going
Yeah,
on, you
yeah.
can share your views,
Yeah.
or
You can
even
volunteer, like I've done at the moment. Yeah, yeah.
to come and share your expertise
Yes.
in any way or form.
Yeah.
So that is basically it. It's
Yeah.
not like poaching you away to Ghana. No. Yeah. I mean, we are doing a great job here.
Yeah.
But then through so many other activities, we can share areas of expertise
Yes.
somehow, isn't
Yeah,
it?
yeah.
And so that is one thing to think about. I always ask everyone, let's start thinking.
Yeah.
We are not going to be working for that much longer anyway, but we still have about 10 years, isn't it,
Yes,
to
yeah,
go. So we
yeah.
can always look into that.
Yeah.
If you are watching us live, we are on Omega Live TV, and we are bringing you this wonderful session on occupational health. I'm sure you will all have some questions to ask. I've got Mrs. Irene Alumenu here with me, and she's an occupational health specialist. I don't know if there are people joining me. My producer, do we have people joining? Yeah, if I can get in touch so we bring you all the questions. So I hope you are getting ready for
That's
that.
fine,
We
yeah,
always have people
that's
joining
fine.
in. Yeah, to let's see who is on there. Yeah, so thank you all. Oh, a lot of you are here. Abba Jacobs is watching, and Abba says, "Well done, senior."
Thank
Mr.
you, Abba.
Charles Quist, Simon Deng. Okay, I am watching in Calgary, Alberta. Oh, wow, wonderful. And I have Ikuya Danswa, our producer, and Mr. Joe Bedu is also watching. And yeah, so many of you are watching. Please share with your friends, like our page, share, and especially now, a lot of us are indoors
I know.
because we are all
Yeah,
grounded,
yeah,
isn't
I
it?
know.
Yeah, so it's a good opportunity to link up on Facebook through Omega Live TV and share this wonderful session with your friends. So I've got Mr. Charles Quist asking. His question is for some reason, your management get to know about one's sickness status through whistleblowing, right, by a member of the occupational health team, he says. What happens? Because it can happen, people talk behind closed doors. Is that possible?
Right. If you find or if you've got evidence that occupational health, a member of the occupational health team has disclosed your health condition to management, then you can by all means ask them why. When we write a report, we have to give you an opportunity to see the report before it goes to your manager. So we won't disclose anything that you are not comfortable for us to disclose, or we wouldn't disclose anything that you haven't given us consent to disclose. And if you find out that a member of an occupational health team has disclosed confidential information, then you can find out and probably report to HR or a senior member of the organization appropriately, whatever your complaint procedure is you follow.
Right, because they are not meant to do that, isn't it? They are not. The occupational health is not meant to disclose.
No,
anything.
not without your consent. As I said, there might be situations where we would say if you feel comfortable to disclose it to your manager so they can support you appropriately at work, then you can disclose. Or we may write something in the report, but it would be with your consent that we would write in the report.
Mr. Quist, I hope your question is answered. Yeah, nothing should be happening without your consent. So consent is not just for operations and stuff like that.
No.
Consent is very important in the referral process, isn't it?
Yes, definitely.
Nothing should be happening without your
the employee's consent.
So I think apart from the referral, which goes with your consent to the occupational health specialist, the report that comes out of this, does it go back to your employers?
Yeah, right. The report would go to the person that referred you and HR, but you would know who it's going to, because usually you would have an HR person and who is responsible for your area, and then you would have, obviously, your manager would have referred you. So the report would go to HR and your manager, as I said earlier on, so that they can put in the support or they can implement the recommendations that we have advised them to implement to support you.
Yeah. So hope your question is answered, Mr. Quist. Now, like I have had encounters with occupational health before, because there was a time when I was allergic to so many things. I was just reacting to them. And I didn't even know what was going on. And eventually it came out that I was reacting to masks, you know,
Oh, okay.
the blue surgical masks
Yeah.
I was reacting to.
Okay.
And then I was, it happened around the time of when we started using blue
Is it latex?
like gowns, not to latex though. That's the
Okay.
funny thing.
Yeah,
And
yeah.
even latex, people are allergic
Yeah.
to latex,
Yeah.
and they get other alternatives,
Yes,
isn't it?
yes.
But mine was, you know, the blue PPE gowns
Oh, okay. Yeah.
and the blue mask. I don't know
Okay.
what it is
Yeah.
in these things, but I was just reacting to them.
Yeah,
I'll
so
be itching all over.
if you were referred,
I was referred.
yeah,
Yeah,
they would
and,
have advised that they look into finding you an alternate
Yeah.
one so that you don't react. Because if you remember earlier on, I said that our job is to ensure that the work that you are doing does not have an adverse effect on your health, or if you have an underlying health condition, it does not have an adverse effect on the ability that you do your job. So we support in
Yeah.
both ways.
So
yeah.
the outcome from this occupational health visit
Yeah.
was that I could use other masks because
Yes.
I was fine with the
That's
other
it,
mask,
yeah.
but not the blue one.
That's it.
So you can imagine my position in this COVID-19 situation. Mine is like special.
Yeah.
Yeah, because I just didn't know what it was
Yeah.
until I started wearing the blue gowns.
Okay.
You know, for when somebody has got CP and you have
Yeah.
to wear those gowns. But there
Yeah.
are no alternatives apparently for the
Okay.
gowns. So then I was given a letter from Oki Health to say I carry that with me wherever I go.
Yeah.
Because if I had to use the gown, I can't.
Yeah.
The masks, I carry the alternatives with me
Yeah.
wherever I go as
Yeah.
well. Yeah.
Yeah.
So these are things that can help us, isn't
Of
it?
course.
Yeah.
And as you rightly said, there might be situations whereby occupational health could advise that you can do, say, 99.9% of your job.
Yeah.
However, there might be 1% of it that you would not be able to do
Yeah.
due to, as you said, probably a reaction or a condition that you may have.
Yeah, so we do always have alternatives and make
Yeah.
use of these professionals because
Yeah.
the recommendation, and I carry that letter in my bag,
Yeah.
my work bag,
Yeah.
all the time. The recommendation was that there are other areas I can work.
That's it. Yeah.
Because when you take any department,
Yeah.
there will be base I can work.
Yeah.
If there is anyone with CPE in a
Yeah.
side room,
Yeah.
I can't work in there because I'll have to wear the gown.
Yeah.
And your colleagues will be understanding of that because the
Definitely.
last thing they will want is a nurse reacting on duty
That's it.
and not being
Yeah.
able to be part of the team,
Yeah.
reducing the numbers. So
Yeah.
the help is there. So I have so many of you joining in and thank you, but I want questions. These days I want you to be asking questions, not just watching.
Yeah.
Think of what you can ask so our resource persons can help. I have Lydia McLean, you're watching, and we have Yaobwedu is watching as well.
Good.
Joyce Ose is
Oh, that's
watching,
good.
Rand. And Sylvia, thanks for tuning in. Sylvia Josel Butau, she's watching from Cambridge.
Oh, wow.
Alberta Awatri is
That's
watching.
good.
And Kobe Mensah, Kobe is watching. I think that's one of my sister's friends. Alberta has got a question for you though.
Good.
She says, in relation with coronavirus, is occupational health supporting staff with underlying medical conditions to be risk assessed to work from home where possible, or is it up to the manager's discretion?
Right. With the COVID situation, obviously, Public Health England have made a decision. The government has made a lot of recommendations,
Yeah.
given a lot of advice. And based on that, various organizations have made their own local decisions as well. So I would say that you would have to follow what your local area advice is. Some are referring to occupational health. In some cases, the manager is making a decision. So I would say you have to follow what your organization has decided
Yeah.
to do because they know the jobs you are doing. They know their situation, and therefore they will be able to advise you appropriately.
Yeah, and
yeah.
practically, I have had to contact like the people I work for instance, because I mean I'm not young anymore,
No.
and I have very little underlying conditions, but then you never know how risky it will be. So then they give you a risk assessment form.
Yeah.
So that you do the assessment.
Yeah.
And then based on what comes out of it, they can decide whether you avoid all those heavy risk areas.
Yeah.
Because we have like emergency department,
Yeah.
we have wards. There will always be designated areas,
That-
isn't it?
yeah,
And
that-
they will always find somewhere
something for you, yeah.
for
So
you.
obviously that's the decision that your local work area or workplace has made. So
Yeah.
that's what you followed and that's what you've
You
done.
follow all
So
those
Alberta,
guidelines, yeah.
that's what you have to do. I'm sure your organization have their own decisions or advice or recommendations they've made in terms of the current situation. So that's what you have to follow.
One thing a lot of us don't do enough of is talking to the right people, isn't it? When we are working in places, we don't
Yeah.
we feel afraid to approach our
You should
managers
not.
to discuss, or feel afraid when all these occupational health referrals are being made, isn't it? But
You
they'll
shouldn't be
always-
afraid.
No.
Occupational health, we are there. Our role is twofold. We are there to support the employee and the employer. Because we've got to give the employer decision to be able, we've got to give the employer information to be able to support the employee. So you should not be afraid to go to occupational health.
Definitely. So Uncle Mr. Kofi Kula, he's one of our presenters here on the political show. He's
Okay.
watching. And Uncle Jude is watching from Ghana.
Oh, that's my brother.
Is it?
Yes.
That's good. Nana Sarah Amufa, she is watching from Cambridge. And Alberta says thank you.
Oh,
Thank you.
it's a pleasure.
Yeah, I've had a number of professionals come here
Yeah.
to do different topics. Obviously, we've done the HIV
Yes.
one, and I
Yeah.
think you've answered that brilliantly about how, once you have the U equals U
Yeah.
sorted,
Yeah.
you can undertake certain
But then we would
Yeah.
have to keep monitoring you depending
monitoring
on
will
the
be-
job that you
Yeah.
are doing.
Okay.
Yeah.
So another professional I had here was into mental health.
Yes.
The very last one actually,
Yeah.
and he did depression,
Yeah.
for instance, and it came out that that can really also cause a lot of people to it's almost like a disability eventually when it's not picked up quickly, isn't it? What sort of help can people like that get? if
Yeah, in the
somebody's-
workplace. So if somebody has any mental health issue, be it depression, anxiety, stress, most organizations have something we call employee assistance program. That's a counseling service which the employee puts in place for the employers.
Okay.
Many a time, and I would say if not 100%, 99% of the time, the employee assistance program service should be confidential, and any employee can contact them for advice. I know that when you contact them for advice, they are not going to tell your employer that you contacted them for X, Y, Z.
Yeah.
If it's a situation whereby work is causing you the stress or anxiety, or obviously to the extent that you are depressed,
Yeah.
then if you say you bring the doctor's report and it says work-related stress, which we see many a time,
Yeah.
then usually your manager would refer you to occupational health for advice and support. So what would happen is, if it's a work-related issue, the occupational health would elaborate what the issue is and then advise the manager what support to put in place to ensure that work is not having an adverse effect on your health. That is, work is not causing you stress or anxiety, because that's not what we want. We want everybody to be happy at work.
Yeah.
And even if you have a condition, work doesn't have an effect on it, and you are able to work despite the condition that you go, which in reasonably, we use the word reasonably a lot, because there might be situations where you might have a condition where you could not just work.
Yeah.
But then they would look for other areas, that's redeployment, if it's possible. Yeah.
And does Oki Health come in when you are about to go on retirement? Is it something that would be considered, and what would be the reason if it is?
Sometimes if somebody is so ill such that they can't do their job, we've got something called ill health retirement assessment. So normally our physician would carry out an ill health retirement assessment to see if the employee qualifies for ill health retirement. Normal retirement without ill health is fine. Obviously, you go on your retirement, but if it's work related, if you are so ill that you are retiring prematurely, that is due to ill health, then we would again advise appropriately. Yeah.
So okay, so can Oki Health actually recommend that based on all the assessments you've had so far?
Yeah.
Early retirement is recommended, or?
Yes. So when you are referred to occupational health, that's one of the conversations that our physician or the nurse might have with the employee, if it's appropriate. And again, if the person is not happy to go on the ill health retirement, then that's a different question, because again, as I said, consent, it would have to be with the person's consent.
Right.
Yeah.
Disability, in reading about all the information that you sent to me, I found disability takes account of a high number of the referrals that you get. So can we look into that aspect? What would be considered as a disability?
Right. So we've got the Equality Act. Under the Equality Act, we've got so many sections of it, and a disability is one aspect of the Equality Act, whereby one might have a condition which is long term, or it's likely to be long term, or has lasted. If it's likely to be long term, that means it's likely to last for more than 12 months. So if you've got a condition that has lasted for more than 12 months, or is likely to last for more than 12 months, and the condition has an adverse effect on your ability to carry out your day-to-day duties, then the condition will come under the disability section of the Equality Act. Under that act, if you've got a condition that comes under the disability section of the Equality Act, the employer has a responsibility to support you to be able to do your work, and that's reasonably. Obviously, they've got to support you reasonably, because if you've got a disability and you are like, we've got to break this wall for you to be able to do your job, that might be unreasonable. So it's got to be reasonable.
Anyway, I will bring you more questions on the disability thing, but just so you know, if you've joined us live on Facebook and on YouTube, we are discussing or looking into the services or the activities or all the benefits we can get from the occupational health specialist. And our guest is Mrs. Irene Alumenu, and this is coming your way by kind courtesy of Omega House Multimedia. If you want all your amazing party favors, all your video coverages, obviously now we have a problem because we can't really have a lot of these social gatherings. But just so you know that you can still contact us for a whole lot of media works, be it your posters, flyers, all your event coverages. You can contact Omega House Multimedia, and you will be glad you did. And also, so you know that they gave us the platform to have all our health professionals come your way through this medium to give us insight into their areas of expertise. And I must say that so far it's been incredible. Mrs. Alumenu is always watching and following all the different sessions. So she loves this much, and it's very important. And I have a lot of revelations coming out of this program with regards to how people are benefiting from this program. So we sometimes underestimate how much we can share with our family and friends. So please tune in, share our page, like our page, join in. Now there's not a lot going on there, so anything that will boost your health, will boost your confidence as a practitioner, of course, will be of great benefit to you. And I also want to say a big thank you to Mama J of Elegant Souls. Mama J has kindly given me wonderful shoes to work as from my last show.
Wow,
that was very unexpected. And you can contact Mama J on 079630 79937. Mama J of Elegant Souls. I will pay you a visit at Elegant Souls one of these days, but I'm really grateful that you believe in this show this much. I still have Matilda Moore has also joined in, and she is watching you, and I guess they all send their love. So I'm going back into my shoes are on the screen now. Yeah. Anyway, yeah. So going back to the disability thing. What conditions will come under disability?
Right. So, as I mentioned earlier on, any condition that is likely to last for more than 12 months
Okay.
and has an adverse effect on one's ability to carry out their day-to-day duty will come under the disability section of the
Yeah.
Equality Act. Also, there are some conditions that come under the disability section of the Equality Act at the point of diagnosis, say HIVs, cancers, multiple sclerosis. Such conditions come under the disability section of the Equality Act
Right.
at the point of diagnosis. As I mentioned earlier on, as a result, the employer has a responsibility to support you reasonably to be able to comfortably do your job if
Yeah.
you've got a disability.
Right. So will somebody with a condition like asthma
Yes.
come under?
Yes. So asthma, most asthmas last for more than 12 months. And if they are not well controlled, they would have an adverse effect on one's ability to lead a normal day-to-day life or carry out their normal day-to-day duties. So yes, asthma would come under the disability section
see.
of the Equality
Right.
Act. Yeah.
So I've got another lady joining, Daniela Pritchard. I remember this lady from the last show because I think she lives in Harlow.
Oh, okay.
Yeah, I do remember. And she says, I had a staff that is 13 weeks pregnant and was asking if needs to self-isolate or not. And I think she says she's asthmatic under the act.
Okay.
Thank you. Oh, so she's saying thank you for me asking about whether asthma is
Yeah,
one
asthma. Yeah, asthma. Somebody with asthma can be vulnerable because their condition, if not well controlled, would come under. Well, the condition comes under the disability section of the Equality Act because if they are not taking their medication, then they
Yeah.
can't carry out their day-to-day duties. Their symptoms would be such that,
Yeah.
they won't be able to. So.
And I guess with her particular question in terms of self-isolating, there are a number of questions that come in as well. And they, like you
Yes.
said, the government has brought on a whole lot of guidelines.
Yes.
Yeah. So
Yeah.
pregnant women, I think, have been mentioned on the
Somewhere
like,
along the line. So I would say that normally I would advise managers to go back and look at it carefully.
Yeah.
And all the answers are there. They've got,
Yeah.
I think, frequently asked questions section where you'll be able to find most of the answers. Yeah.
So Daniela, I think it's loud and clear now, I
Yes.
guess, because asthma is a respiratory condition.
Yes, yeah.
And this virus going around is attacking the respiratory system.
Yes.
So being pregnant and then
having the underlying health condition.
will probably put you at risk.
Yes.
But because we don't know exactly what this person does,
Yes.
because for instance, if you can normally work from home, you can discuss with your manager and can discuss
Again,
from home, isn't it?
You've got to follow the organization guidelines.
Guidelines. So speak to your managers. They will be of useful help, especially in this time.
Yes.
So Irene, I'll just give you the opportunity, just pour out your heart. Let us know anything else that we need to capture under Oki Health that we haven't covered so far.
Okay, so we don't just deal with referrals. We deal with students as well. Students within the healthcare profession or education who go on placement. Any student that goes on in placement, we do. We would look after them. So we would make sure that they have had all their vaccinations to ensure that they are protected to go on placement. Whilst they're on placement, if they have any issues, they would come back to see us and we would support them appropriately. So say dental students, medical students, nurses, social work, paramedics, pharmacy students, dietetic students, name it, we deal with students doing educational courses, we would support.
One group of workers that a lot of people, as in ethnic minorities, will probably fall under is people who do cleaning work. And a lot of these people also happen to work for like very small groups,
Contractors.
isn't it? Contractors and stuff like that. What
Yeah.
sort of advice can you give to such people? Because they are the very ones who probably don't know how to seek help or
Yeah.
where to seek help.
I would say that the contractor would normally, if they don't know, they should ask the large organization that they are working for or that they have the contracts with, if they could use their occupational health service. Because as you rightly said, domestic staff are very important within the working population,
Yeah.
and therefore it's important that they are well protected to do the job that
Definitely,
they are
yeah.
doing. Because, for instance, one thing I advise, one advice I give to such contractors is they don't realize that these workers have the risk of coming into contact with things like needles that has been used by all sorts of people. So it's important that they are protected against bloodborne viruses that can be passed through and needle stick injuries. So something like hepatitis B, I would advise that such group of the group of workers that come under that category should be hepatitis B protected because of the job they do. Yeah. And then, to be honest, all the childhood vaccinations, it's important that you are up to date, because with the areas that these group of workers work, they work in all sorts of areas that I'll say measles, rubella, chickenpox. These are childhood vaccinations that everybody in this country would be given, every child in this country would be given. So the advice I give is, if your parents haven't taken you to your GP for your childhood vaccinations, this is the time you can take yourself. So it should be free to go to your GP for your measles, chickenpox, and yeah. If you haven't had
free.
it's a free. If you are a child, it's free, and I can't see your GP charging you if you haven't had it as a child. If you haven't had it as a child and you go, then you should be given.
Yeah, I see. And then we'll probably take this last question. He says, Mr. Charles Quist is saying, what about professionals suffering from chronic musculoskeletal disorders? I think you probably mentioned it along the line, isn't it?
Yeah, so musculoskeletal disorders comprise of back problems, upper limb disorders, knee problems, things like that. If it's long term, again, if the condition is having an adverse effect on your ability to do the job that you've been employed to do, then your manager would refer you to occupational health. Occupational health would give advice. You might need some economic equipment. If it's your back, you might need a special chair that supports you better than probably your current chair. Or if it's a wrist, they might give you, and you can't use or you're finding it difficult to use the mouse that you currently use, then they might get an ergonomic one that would be probably better for you.
Yeah, wonderful. So I think we've nearly come to the end of the session. I can't believe that an hour has gone already. It's just flown past. But what content? I have totally enjoyed it, and it's giving us a lot of content. I think people don't utilize the services because they don't even know what they are asking for, and they don't know who to go to. But it's clear from what you have said that we can even self-refer, isn't it?
You can't self-refer, but some organizations, you have to check your organizational policy. Some organizations would not allow self-referral. And self-referral, you could. However, what happens is if you self-refer, then recommendations don't go to your manager. So then what is the point? Because you are referring so that something can be done. So I would say that it's important that you approach your manager and say, I've got a condition, could you refer me to occupational health, so I'll see what advice they can give me. So you can approach it that way. But you can't self-refer. I'm sure any occupational health practitioner will give you advice, but who does the report go to?
Right.
Yeah.
Okay. So the report has to go somewhere, and the reason why it's important, it goes through the right channel.
Exactly.
If you have been joined in on Facebook and on YouTube, we have been looking into occupational health services. This is not like treating a condition like heart attack or
It's
looking into
advisory and support.
depression. It has been purely advisory and purely support. And it is both in the best interest of the employer and the employee.
That's it.
For them to either side to seek the services of occupational health. They are not witch hunters.
No, we know.
It is clear that they are not witch hunters, but they are not amazing people who work professionally and keep your information in confidence. So you'll be rest assured that whatever information you share with them should be held in confidence, and there will be, if it is not, you will have other ways to channel
with it.
To deal with it. So Mrs. Irene Alominu, I am so grateful that you came. I know you are a big fan of this show. You are always watching, always encouraging me. Do you have one last thing to say, and then we will round off for tonight? And
as you mentioned earlier on, again, occupational health, we are not disciplinary. A lot of people see us as disciplinary. Far from that, we are not disciplinary. We are there to support employees and the employer. Our role is twofold, and therefore, if you have an issue at work, do not suffer in silence. Seek advice and support so you can work comfortably. Thank you.
Wonderful. Wonderful. Thank you also very much for tuning in on Facebook and on YouTube. Don't suffer in silence. If you work here in England, then I'm sure in other developed countries and even in Ghana, there's always somebody you can channel your, your worries from work and your concerns to. So it's been fantastic. Thank you. I hope you will come again. If there's any topic and any doubt, you come and help us. If you have any questions later after the show you want to ask Mrs. Alominu, you can channel it to me, send me a message, and then I will give you the feedback along the line, either on Messenger or on Facebook. It's been wonderful.
Thank you very much.
So much for giving us the
insight
into
for having me.
Oki Health. Thanks. So I say a big thank you to Omega Life TV for giving us the platform for our health professionals to come and talk to us. We don't know what the climate is going to be in terms of bringing you more shows, whether there's going to be complete lockdown amidst the coronavirus, but we will still endeavor to bring you all your health professionals to give you very relevant topics which could save a life. Share it with your family, share it with your friends. You never know, it will be of great benefit to someone. Until we come again next time, and I'm not going to say when because I don't know what is going to happen. Work hard as if all depends on you, and pray hard as if all depends on God. I love you so much. Bye. Thank you.
House, West Green Road. Within the Abegwagi Santana, I love them because they are good and they are original. Our prices are so absolutely incredible and affordable. We are professional. I love them. Peace. Everybody do what you doing. Smile will give you sunshine day. Yo, what's up? My name is Abegwagi Santana. You don't know, Top Skanka. Yo, the original Mr. Tourism, your number one radio pastor, preacher, presenter, philosopher, lawyer, Dr. Santana. We were here West Green Road, a Omega House. Omega House, a one-stop photo shop. BBA photo, BBA gift item, BBA souvenir, BBA printing, BBA images. Outstanding, stunning, absolutely incredible quality work and large format printing into pre-wedding and I say wedding or engagement or outdoor or baby naming ceremony or christening or baby shower. I'm talking about that event now here for to be to me framing souvenirs, gift items, so look no further. So baby quality photography and photo images production, printing, any gift items, Omega House, West Green Road. Within the Abegwagi Santana, I love them because they are good and they are original. Our prices are so absolutely incredible and affordable. We are professional. I love them. Peace. Everybody do what you doing. Smile will give you sunshine day. Yo, what's up? My name is Abeku Agri Santana. You don't know, Top Skanka. Yo, the original Mr. Tourism, your #1 radio pastor, preacher, presenter, philosopher, lawyer, Dr. Santana. Me were here West Green Road, Omega House, one-stop photo shop. BBA photo, BBA gift item, BBA souvenir, BBA printing, BBA images. Outstanding, stunning, absolutely incredible quality work and large format printing into pre-wedding and I say wedding or engagement or outdoor or baby naming ceremony or christening or baby shower. I'm talking about that event now here for to be a to me a framing souvenirs, gift items, so look no further. So baby quality photography and photo images production, printing, any gift items, Omega House, West Green Road. Within the Abeku Agri Santana, I love them because they are good and they are original. Our prices are so absolutely incredible and affordable. We are professional. I love them. Peace.